Hello, today we will be talking about a laparoscopic gallbladder removal surgery. Para español, cambie al canal dos, por favor. A laparoscopic gallbladder removal surgery involves removing the gallbladder and gallstones using a laparoscope, which is a thin, metal, flexible tube with a light and tiny camera that is put into the belly to see the organs, including the gallbladder. This video will provide information about what will happen before, during, and after the surgery. But first, let's take a look at a viewer's response.
Hello, my name is Mrs. Farbarger. I had a laparoscopic gallbladder removal surgery about 2 months ago, and I tell you what, I found this video to be so helpful. I was so confused when they gave me all these papers to read. I'm like, are you serious here? I didn't know what to do. I was like, where am I going to go? Where can I get information that helps me understand what's going to happen? Because I like to see things so that I can know what they're going to do. Who would have thought that this video could teach me so much in a short period of time? Here, take a look.
What is the gallbladder and its function? The gallbladder is a small, pear-shaped organ located under the liver that stores bile. Bile is a liquid that helps in breaking down fatty foods. What are the reasons for having this surgery? You may have gallstones, which are tiny masses that form in the gallbladder. You may have pain and inflammation or swelling of the gallbladder. You may have cancer of the gallbladder, but this is rare. Before your surgery, a nurse will ask you questions about your health history and your surgery. These questions may be asked during pre-admission testing in the hospital.
Hello, Ms. Smith. I'm Nurse Grace, and I'm here to help complete your pre-admission testing. I understand that you're here to have your gallbladder removed. Is that correct?
Yes, that's correct.
That's great. Now, before we start with your health history, I want to make sure that you understand informed consent, advance directive, or living will. Has your doctor explained the procedure to you?
Yes, my doctor explained it to me, and I've signed the forms and I'm willing to go for the surgery.
That's great. Now, signing the informed consent means that you understand the procedure and you're willing to undergo the procedure. With an advance directive or living will, this just helps the healthcare providers to follow your wishes for treatments or in situations where you may not be able to make decisions for yourself.
Yes, I'm aware of it, and I've made copies for my doctor and my family.
That's great. It's always important to make copies for your doctor and your family members. I also have here some basic information like your name and your date of birth. And your chart also shows that you have no known allergies. Is that correct?
Yes, I have no allergies.
That's great. I also have here the list of your medications and your blood work. Now let's start with your medical history.
As you can see, it is important to complete the pre-admission testing before the surgery and have a medical evaluation. During the medical evaluation, the nurse gets your medical history, such as any pre-existing medical conditions that you may have, including heart or lung problems. It is also important to know if you smoke, because you will be asked not to smoke before and after the surgery, as smoking can slow down the healing after the surgery. You need to quit at least 2 weeks before the surgery. And the nurse can help provide information of local programs that can help you to stop smoking. So what is important for pre-admission testing? The signed informed consent, an advance directive or living will, completing ordered lab work, and bringing all your current medications with you. Now that we have discussed pre-admission testing, we will begin the preparation for the surgery. The doctor may ask you to completely empty your colon by drinking clear liquids like water, plain coffee, tea, for 1 or several days before the surgery. It is best to shower the night before or morning of the surgery. The midnight before the surgery, you should not eat or drink anything except medications that your doctor has told you to take, and only take these medications with a sip of water or in the morning of the surgery. Some medications such as aspirin, blood thinners, and arthritis medications will need to be stopped temporarily because they may cause problems in the surgery. It is also important to be sure to have someone drive you home after the surgery. The nurse will start teaching the importance of being active as soon as possible after the surgery, because lying in one position for too long can slow your recovery. Nurses will help you get out of the bed and walk. You will also be taught how to cough and deep breathe 5 to 6 times every 1 to 2 hours while you're awake. This will help you decrease your chances of getting pneumonia. It is normal to have pain around the area of surgery, but if you have pain, ask the nurse to give you pain medication. It is important to take the pain medications as ordered by your doctor so that you are able to move, cough, and deep breathe. You may also have shoulder pain in your right shoulder, which is caused from the gas that is used to fill up your belly so that the doctor can see the organs better and prevent injury. Lying down and applying a heating pad can help with the shoulder pain, and it is expected to go away after a few days. On the day of the surgery, the nurse will take your vital signs, which include your temperature, your pulse, respirations, and blood pressure. The nurse may also put a needle into your vein, which is called an IV, to give medications and fluids if you need them. The nurse will take out the IV once you can drink enough fluids. It is important that dentures, eyeglasses, hearing aids, contact lenses, any jewelry, hair clips, etc. be removed before the surgery. Your family will be able to stay with you before you go into surgery, and the nurse will be there to answer any questions and provide your family with information while you are in surgery. So what is the preparation? Empty your colon. Have a clear liquid diet such as water, plain tea, coffee, broth, or diet soda. Have someone drive you home. Only take medications that the doctor allows you to with a sip of water on the morning of the surgery. Before the surgery, you will be giving general anesthesia. This will help relax your muscles and put you to sleep to prevent you from feeling pain during the surgery. How about we take a look at what will happen during the surgery? A small cut is made above the belly button. Then a needle will be inserted into the belly, and the belly will be filled up with gas. An opening above the belly button is made for the laparoscope. 3 more cuts will be made with care to keep the openings as small as possible. Once in place, the laparoscope will provide video images that allow the surgeon to locate and pull back the liver and the gallbladder. Next, the surgeon removes the tissues that connect. The surgical team then uses clips to clamp off the duct and the artery. They are cut later to prepare the gallbladder for removal. Finally, any remaining tissue connecting the gallbladder to the liver is cut. The gallbladder is moved into the laparoscope where it is taken out of the body. All of the instruments are then taken out of the body. The gas is allowed to escape, the tissues are sewn together, and the skin is closed with stitches or staples. Finally, sterile dressings are applied. A laparoscopic gallbladder removal surgery can lead to an open gallbladder removal surgery in a small number of patients. Factors like obesity, a history of previous belly surgery with scar tissue, or bleeding problems during the surgery might require the surgeon to perform an open gallbladder removal. This is when the surgeon makes a bigger cut into your belly to remove the gallbladder for your patient's safety. What are the benefits and risks of a laparoscopic gallbladder removal? This surgery includes only 4 small cuts in the belly. Patients experience smaller levels of pain, and most patients go home on the same day of surgery. Patients also have quicker return to normal activities and faster recovery than open gallbladder surgery. What are the possible complications? There are risks that may come with any kind of surgery. However, most patients experience few or no complications with this surgery. Some of the possible complications of this surgery are bleeding, infection, pneumonia, blood clots, or heart problems. After your surgery, you will be taken to a post-anesthesia care unit, also known as a PACU, which is a recovery area where the nurse will closely monitor you. When you first awake, you may feel cold and shiver, but this is normal due to the general anesthesia. When you are awake and your vital signs are normal, you will be taken to your hospital room and be reminded of the activities that need to be completed after the surgery. Patient activities after surgery. Begin some light exercise, such as walking. Cough and deep breathe 5 to 6 times every 1 to 2 hours. Use a pillow over the surgery site when coughing to help decrease the pain. Use a heating pad 15 to 20 minutes hourly for shoulder pain. Take your pain medications as ordered from your doctor. Discharge teaching. When you are ready to go home, you will be given discharge instructions. These instructions will tell you about lifting and activity restrictions, medicines you need to take, and when to return to your doctor. Be sure to follow these instructions very carefully. Activity restrictions. Do not lift more than 30 pounds. Do not participate in heavy exercises for 4 weeks. Return to your normal activities at a slow pace. How do I care for the wound? Look at the wounds each day. Each wound should be dry and closed. Your wounds may be covered with tape. Try to keep the tape clean and dry. If the tape falls off at home, you can leave it off. If you have stitches or clips in the wounds, they will be taken out at your follow-up visit with the doctor. Make sure you have a follow-up appointment with your doctor. Contact your doctor's office for an appointment if you have not been given one. You can follow your regular diet at home. You can have fatty foods after the surgery, but it is good to choose foods that are lower in fat. You can call your doctor if you have any questions about your diet. Call your family doctor if any wound is red, swollen, painful, bleeding, or leaking milky fluid. You have a fever of 100 degrees and above. You vomit and continue to feel sick, or you have chest pain or feel short of breath. Things to remember. Make sure you have completed the preparation before the surgery. Not following the preparation orders may delay the surgery. Arrange someone to drive you home after surgery because you may still feel drowsy from the anesthesia. If you smoke, plan to quit smoking at least 2 weeks before the surgery. Be sure to follow with your doctor after the surgery. So what have we learned? A laparoscopic gallbladder removal surgery can be used to remove the gallbladder. Patients normally return home the same day of surgery, unless there are complications, but again, it is rare to have complications. In most cases, patients return back to their normal activities in a short period of time. After watching this video, if you have any questions, please call your doctor for more information. And remember, it is your right as the patient to have all the information about your surgery.